Hello and welcome to our Dollars and Donuts series featuring a Medicaid overview. My name is Eric Richardson and I staff the Health and Human Services Appropriations Subcommittee, including Medicaid issues. I will run through a high-level overview of Medicaid, which is an issue that will likely be discussed in earnest over the next few years. Medicaid, also known as medical assistance, is a joint federal and state program created under the Federal Social Security Act. It is an entitlement program, meaning anyone who applies that meets federal and state eligibility criteria must be served. Medicaid must be available statewide to all clients, no matter where they live. It is managed by the Centers for Medicare and Medicaid Services, known as CMS, on the federal level, and by the Department of Human Services on the state level. Medicare and Medicaid are sometimes confused. Medicare is administered and funded at the federal level, while Medicaid is administered at the state level and is funded through state and federal appropriations. Medicare beneficiaries are mostly people age 65 and older and people under 65 with certain disabilities, while Medicaid focuses on mostly low-income adults, pregnant women, children, and some disabled and elderly folks. Medicare coverage is consistent nationally given federal administration and is the primary payer when a beneficiary is eligible for both Medicare and Medicaid. Medicaid coverage varies by state and is the payer of last resort. You'll hear the acronym FMAP frequently in relation to Medicaid. FMAP is the Federal Medical Assistance Percentage, which is the percentage of federal payment of Medicaid expenditures to state payment of Medicaid expenditures. There is a complex formula used to determine how much the state pays for Medicaid, which is based on the per capita income in Iowa compared to the United States per capita income. The formula considers total annual personal income in the state in a federal fiscal year and divides that number by the total population in the state. We are currently in federal fiscal year 2023. In federal fiscal year 2024, set to begin September 30th, 2023, the highest state FMAP rate is Mississippi at 77.27%, which means that the federal government pays for 77.27% of all Medicaid expenditures in a fiscal year, while Mississippi needs to pay 22.73% of all expenditures. The lowest FMAP rates are at 50%, the lowest allowed by law and shared by 10 states. Alaska was at 50% for a number of years before theirs increased to 50.01% for FY 2024. Iowa's federal fiscal year 2024 FMAP rate is 64.13%. This is a 1% increase from the FY 2023 FMAP rate. As you can see in the graph, Iowa's FMAP rate was relatively stable from 1992 until about 2010 when it began dropping. After 2016, the rate began rising again. This means that relative to other states, Iowa's per capita income measure is growing slower compared to other states. This FMAP rate does not include any enhanced FMAP associated with the federal public health emergency, which is set to end on April 1st. During the public health emergency, Iowa received a temporary 6.2% increase in the FMAP rate, which will be scaled down slowly throughout the rest of the calendar year after the PHE ends. To be eligible for Medicaid, you must be categorically eligible unless you are participating in the Iowa Health and Wellness Program, or IHOP, which is the Medicaid expansion under the Affordable Care Act. This means that to be eligible, one must fall into a specific category, such as a child, pregnant woman, family with a dependent child, an elderly person, a blind person, or a disabled person. You must provide citizenship and provide identification. This chart illustrates eligibility for potential Medicaid beneficiaries. In calendar year 2022, the federal poverty level, or FPL, for a family of 4 was $27,750. For various beneficiaries and programs, the FPL percentage allowance is listed. The greatest allowances for Medicaid enrollment are for children under age 1 and pregnant women. Note that the Children's Health Insurance Program in Iowa, known as Hawkeye, has a greater FPL allowance compared to the regular Medicaid program and is highlighted in the chart. Here are the calendar year 2022 federal poverty level limits as percentages of the FPL to illustrate the ranges based on percentages and family size. As of November 2022, there were 527,411 individuals enrolled in the Medicaid program in Iowa. This includes 311,000 children, 100,000 adults, 33,000 elderly, and 83,000 disabled. This slide illustrates the 2-year trend of Medicaid enrollment. The brownish line in the middle moving upwards represents total enrollment, with the bars representing the different categories of beneficiaries. As you can see, enrollment has been moving steadily upwards. During the PHE, the state has not been allowed to disenroll anybody from Medicaid in exchange for the enhanced FMAP. Starting April 1st, 2023, Iowa will be allowed to disenroll anybody who does not meet income eligibility moving forward. This graph comes from the Iowa HHS and illustrates Medicaid's share of the healthcare market in Iowa. Medicaid covers 1 in 2 childbirths, 1 in 2 children, 1 in 5 adults, 1 in 10 elderly, 1 in 4 individuals with disabilities, and 1 in 2 nursing home residents. This slide details the changeover in Medicaid from a fee-for-service model to a managed care model. Prior to April 1st, 2016, Iowa Medicaid operated under mainly a fee-for-service model. In a fee-for-service model, providers are paid for each service they provide, such as an office visit, blood test, or surgery. Iowa Medicaid previously handled over 23 million claims per year and contracted with over 38,000 providers, so the administrative burden was enormous. Starting in 2016, coverage of 94% of Medicaid clients was transferred to the management of 2 managed care organizations, or MCOs. Currently, Amerigroup Iowa and Iowa Total Care. Molina Healthcare of Iowa is set to be the 3rd MCO as of July 1st, 2023. MCOs are insurance companies that have goals of managing cost and utilization and improving quality. MCOs rely on capitation payments from the state and accept a set per member per month or capitation payment for services. This provides the state with more certainty in regard to Medicaid expenditures. Some examples include a healthy child between ages 1 and 5. The MCO receives $173 per month for her care, while the MCO receives $3,611 per month for grandma's care in a nursing home. Every year, the MCOs contract with the state any potential increases in capitation payments. Iowa is required by the federal government to provide a minimum set of benefits in order to receive federal match funds. These services include inpatient and outpatient hospital services, physician services, medical and surgical dental services, nursing home care, home health care, family planning services, laboratory and X-ray services, and early periodic screen, diagnosis, and treatment services, along with other services. Iowa has also been given the flexibility to provide additional services to clients. Some of the optional services available include intermediate care facilities, pharmacy benefits, home and community-based services waivers or HCBS, mental health and substance abuse services, rehabilitation services, hospice, medical supplies, dentists, case management, ambulance, and other services. I'll talk about the HCBS waiver program because it is a large part of Iowa Medicaid. Iowa has 7 different HCBS waivers, which are available to clients who otherwise would require care in an institution, but can remain in their home. Waivers include the Ill and Handicap Waiver, which provides services for blind or disabled persons under the age of 65, the AIDS HIV Waiver, the Elderly Waiver, the Intellectual Disabilities Waiver, the Brain Injury Waiver, the Physical Disability Waiver, and the Children's Mental Health Waiver, which provides services for children diagnosed with a serious emotional disturbance. The HCBS waivers provide individuals access to a variety of different supplemental services. Some of the more common waiver services include adult daycare, consumer-directed attendant care, home and vehicle modification, home health aides, supported community living, respite care, transportation services, and a consumer choice option. Next, I'll move on to the Iowa Health and Wellness Program, known as IHOP. This is the Medicaid expansion as part of the Federal Affordable Care Act. The program covers adults aged 19 through 64 with income between 0 to 133% of the FPL who are not otherwise eligible for Medicaid, Medicare, or affordable insurance. Clients are enrolled with an MCO and have access to the same provider network as a regular Medicaid program. Enrollees are eligible for 12 months with income re-verified for eligibility near the end of the 12-month period. For IHOP, there are no copayments except $8 for using the emergency room when it is not a medical emergency. There are no monthly contributions or premiums in the first year, and no contributions after the first year if the member completes preventative services and/or wellness activities. There are monthly contributions only for adults with income at 50% of the FPL or above if preventative services and/or wellness activities are not completed. As of November 2022, there were approximately 259,000 individuals enrolled in the IHOP. The program has seen the same surge in enrollment due to the disenrollment requirements related to the 6.2% enhanced FMAP maintenance of effort requirement as Medicaid, and has added approximately 82,000 individuals since the beginning of the pandemic in March 2020. Once the PHE ends on April 1st, clients may be disenrolled based on income eligibility or other factors. Overall expenditures for Medicaid and IHOP in FY 2022 totaled $6.555 billion. This includes approximately $4.8 billion in federal payments, $1.6 billion in state funds, and $151.5 million from other funds such as hospital fees. Top expenditure categories include hospitals, nursing facilities, intermediate care facilities, HCBS waivers, mental health services, and physicians. This graph looks at FY 2022 Medicaid enrollment and expenditures. 58.2% of enrollees were children, with smaller percentages for the disabled, adults, and the elderly. On the expenditure side, nearly half were due to the disabled, with smaller percentages for children, the elderly, and adults. Interestingly, while the disabled and elderly account for only 23.3% of enrollees, they accounted for 65% of expenditures in FY 2022. So what drives Medicaid costs? First, it is enrollment, which has grown extensively over the last 3 years. Then comes utilization and services and trends in the healthcare system. Another factor is changes in federal law, includes changes in the FMAP rate and Medicare Part D payments. Specifically with Medicare Part D, if Medicare does not cover some drugs, benefits are reduced, while the cost of Medicare Part D increases. This has a spillover effect on Medicaid. There is also a Medicaid supplement for those low-income seniors unable to afford Medicare premiums. Any changes in state law also affect Medicaid, including new services, eligibility changes, and provider rate reimbursement changes. What are the legislature's responsibilities? The legislature is allowed to set provider rates, and every year provider rates are set in the Health and Human Services Appropriations Bill. During the 2022 session, that was House File 2578. And beginning around page 57 of that bill, there are numerous clauses outlining provider rates for FY 2023, most of which were status quo from FY 2022. The legislature also decides the amount, scope, and duration of optional services, sets rules, regulations, and processes not governed by the federal government, such as prior authorization for services or additional provider audits. The legislature may also change eligibility, premiums, or enrollment fees, or impose more restrictive eligibility procedures, except when prohibited by federal law. Next, I'll discuss the state Medicaid forecast. LSA, HHS, and the Department of Management meet quarterly to discuss estimated Medicaid expenditures and agree on an estimated need or surplus for current and future fiscal years. We met on December 20th, 2022, and agreed to the following. For FY 2023, the group estimate was that Medicaid will have a surplus of $322.7 million. And in FY 2024, the group estimate was that Medicaid will have a surplus of $104.2 million. This was before the Consolidated Appropriations Act authorized the end of the public health emergency for April 1st, 2023. So at our next meeting in March, if all other factors remain constant, the surplus for FY 2024 is likely to increase slightly over this amount. LSA publishes a summary of the forecast meeting, which you can find at the link in the presentation. LSA also publishes various articles and reports on Medicaid, which can also be found here in the presentation, and my contact information can be found below. You can find the address for all of LSA's publications in this slide. Thank you.